Welcome back. The next phase of the COVID-19 vaccine rollout is expected to start in KwaZulu-Natal on the 1st of May. Now, that's according to the Premier of the province, Sihle Zikalala. The KZN Premier says he's confident the province will be able to achieve its targets. Earlier, Premier Zikalala outlined the province's vaccine rollout plans. Now, joining me for more on this is our reporter, Dasen Thathiah. A very good afternoon to you, Dasen. So the Premier, of course, has just briefed the media on the latest KZN figures. What can you tell us?
Well, he's very concerned, I'll tell you that much. This is because KwaZulu-Natal is still ranking second highest in the country in terms of cases and the fourth highest in terms of fatalities. So that was the key tone in his address this afternoon, saying that that is still a worrying trend. He identified two districts, the KZN district as well as the Utugela district as well, where he says that they've now noticed that there's a spike in cases there. In KZN district, for example, there's a 50% increase. So although largely the cases and the numbers over the past week have remained over 100 per day, there are still these pockets where there are problems in the province. But let's listen to him elaborate on those latest numbers in part of his briefing that we'll play now.
Province of KwaZulu-Natal continues to rank the second highest in terms of the number of laboratory confirmed cases countrywide, contributing 21% of cases. The average number of cases recorded in the past 7 days declined to below 100 cases per day. The province continues to rank the fourth highest in terms of fatalities countrywide, following Eastern Cape, Gauteng, and Western Cape. We have continued to observe a decline in number of new cases recorded weekly. The overall percentage change in number of new cases between week 15 and 16 was a decline of 8%. The actual number of new cases was 606 for week 15 and 555 for week 16 respectively.
Dasen, of course, the Premier also said something about the province's plan on the next phase of the vaccine.
That's right. So you know that the next phase of the vaccine here will be phase 1B, and immediately after that will be phase 2. So primarily in the initial phases, it was the frontline workers, the healthcare workers. They'll now also be looking at other healthcare workers as well as those with comorbidities that will be targeted in the next phase. But something interesting on vaccines as well in the province, and this came from the province's health MEC, and she was saying that the province will be adopting a very strategic and approach in how it rolls out these vaccines. For example, you know that in rural areas in KwaZulu-Natal, it would be a bit difficult for some of those that are being vaccinated there to make 2 trips, because you know that one type of the vaccine actually requires the patient to come back again and be vaccinated again in about 6 to 8 weeks, and in others it would be just the first shot. So they being strategic about how they apply this. For example, in the more urban areas, they're saying these centers are more accessible to those who live here, so they can make that second trip. But however, in rural areas, they want to ensure that the vaccine that gets there will be the one, and I think it's the Johnson & Johnson vaccine that they'll be using there, which will ensure that there's no inconvenience to anyone in that area. But let's listen to what the Premier had said about the next phase of the vaccine rollout in KZN.
With regard to the vaccination program, the Sisonke Johnson & Johnson study, also known as Phase 1A, will resume soon and is expected to end on the 30th of April 2021. Phase 1B will commence on the 1st of May 2021 and end on the 16th of May. Since Phase 1A of the vaccination process began on the 18th of February and until its voluntarily suspension on the 12th of April, the province of KwaZulu-Natal had vaccinated a total of 51,615 health workers at 91 sites throughout the province. This was made up of 37,457 health workers from the public sector and the remaining 14,158 from the private sector. As part of phase 1B, if the adequate number of vaccines is received, to vaccinate the remaining 81,238 public health care workers over 7 days, we could meet a provincial daily target of 11,605 workers.
The Premier also, of course, raised concerns about, of course, things happening in the province. Dasen?
That's right. So he's not too happy with how some of the residents here in the province have been behaving. I mean, and this is not the first time that we're seeing such complacency, as he called it. We saw it last year as well, when we saw the second wave hitting the province and the country. And he says that there are lessons that should be learned, but yet they're still noticing bad behavior. But he's also said that they will not be afraid to do surprise visits, for example, to restaurants, other public places, and to clamp down on anyone that may be contravening any of these regulations. They say that they'll also be able to ban trading in some instances if those establishments are found to be non-compliant. So he did speak briefly on this, and he has encouraged everyone to ensure that they continue to maintain social distance and wear their masks as they have been, despite a relatively low number of cases at the moment. Let's listen to what he had to say about that.
We are quite concerned about complacency. We've noted with a great sense of worry various forms of behavior that indicate a high level of complacency, especially when it comes to adherence to COVID-19 safety precautions. Far too many people seem to have lowered their guard. They are no longer wearing their mask in public, and many are carrying themselves they carry masks for just compliance. There is no social distancing, let alone regular hand sanitization or washing of hands with water and soap. People are gathering in large groups, especially at restaurants, pubs, nightclubs, and taverns. Some shops are even allowing more people than required numbers, while others seemingly don't bother to have hand sanitizers at the door.
That is, of course, our reporter, Dasen Thathiah. Thank you very much. He was, of course, just attending that briefing by the Premier Sihle Zikalala.